What do your liver test results mean? Imagine your blood as a messenger carrying important clues about your liver's health. When you get liver test results, you're essentially getting a report card on how well your liver is functioning. These tests, often called liver function tests or liver panels, measure various enzymes, proteins, and substances in your blood to give insight into your liver's condition. They help detect signs of damage, inflammation, or disease, but an abnormal result alone doesn't tell the full story. It's important to understand what each part of the test measures and what deviations from normal might indicate. One of the key markers is alanine transaminase and aspartate transaminase. These are enzymes released into your blood when liver cells are damaged. Elevated levels of these enzymes often suggest some form of liver cell injury, which can happen in conditions like hepatitis, fatty liver disease, or even liver cancer. Alanine transaminase is more specific to the liver, while aspartate transaminase can also be elevated in muscle or heart issues. So, if your aspartate transaminase is high but alanine transaminase is normal, other causes like muscle or heart problems might be involved. Alkaline phosphatase is another enzyme that relates to the bile ducts. If this enzyme is high, it could point to bile duct blockage, liver cancer, or bone disease. When alkaline phosphatase and bilirubin levels are both elevated, especially if bilirubin is high, it might suggest problems with bile flow, known as cholestasis. Gamma-glutamyl transferase helps identify issues with the liver or bile ducts and can be elevated in cases related to alcohol use or bile duct obstruction. Bilirubin itself is a waste product from the breakdown of red blood cells, processed by the liver. High bilirubin levels can cause jaundice, which is the yellowing of the skin and eyes, and may indicate liver dysfunction, bile duct blockage, or increased red blood cell breakdown. Albumin and total protein are proteins made by the liver. Low levels can suggest that your liver isn't producing enough proteins, often seen in chronic liver disease or liver cancer. Prothrombin time measures how long it takes your blood to clot, and since clotting factors are made by the liver, a longer time can mean your liver's synthetic function is impaired, especially in advanced liver disease. Lactate dehydrogenase is an enzyme found in many tissues, including the liver. Elevated levels can indicate liver injury but are less specific, so they are usually considered alongside other tests. When you look at your results, normal levels generally mean your liver is functioning well. However, even normal results don't completely rule out early or mild liver issues. Mild elevations in liver enzymes, less than twice the upper limit of normal, might be temporary or due to minor stress on the liver. Repeating tests and considering your overall health and symptoms is important. Significant elevations, more than 2 or 3 times the normal limit, usually requiring further investigation, such as imaging or consultation with a liver specialist. The pattern of which enzymes are elevated can also give clues. For example, if alanine transaminase and aspartate transaminase are high, it often points to direct liver cell damage. If alkaline phosphatase and bilirubin are high, it might suggest problems with bile flow or bile duct obstruction. Interpreting these results always depends on your medical history, symptoms, risk factors like alcohol use or viral hepatitis exposure, and physical examination. Some liver diseases, including liver cancer, may initially cause subtle changes or no symptoms at all but can still be detected through blood tests. If your liver tests are abnormal, your healthcare provider might suggest additional tests like ultrasound, CORT scans, or blood tests for hepatitis viruses to find out what's going on. Monitoring your liver tests over time can also help track disease progression or response to treatment, especially in chronic conditions or liver cancer. Remember, liver test results are a piece of the puzzle. They provide valuable clues but need to be interpreted carefully by healthcare professionals. If your results are abnormal, don't panic. Instead, seek guidance from your doctor who can evaluate your overall health, perform further testing if needed, and help you understand what steps to take next. Your liver is vital for your overall health, and understanding these results is an important part of maintaining it. Always consult your healthcare provider for personalized advice and treatment options.